Welcome to our presentation, Developed to Raise Awareness About Anal Cancer. March 21st is International Anal Cancer Awareness Day. Because of this, we want to highlight the importance of knowing the risk factors for developing this type of cancer and how to reduce your risk. What is anal cancer? The Fred Hutch Cancer Center defines anal cancer as a cancer that occurs when the cells in the layer of the anus or anal canal begin to grow irregularly and form a tumor. You can see the placement of where a cancerous tumor might occur in the image to the right of the slide. There are two common types of anal cancer that can occur. The most common type is called squamous cell carcinoma, and it occurs on the cells lining the skin of the anus or the anal canal. The other is called adenocarcinoma, which can start in the upper anal canal or under the glands that make mucus. Being infected with a certain type of HPV or human papillomavirus is linked to the most common type of anal cancer, squamous cell carcinoma. Anal cancer is rare in the U.S. However, we have observed an increase in cases in recent years. Surveillance, Epidemiology, and End Results, or SEER, in the U.S. has reported 9,760 new cases and 1,870 deaths from anal cancer in 2023. However, the American Cancer Society predicts that there will be over 10,400 new cases and 2,100 deaths from anal cancer in the year 2024. Why are rates rising? This leaves it up to scientists to answer the question, why are anal cancer rates rising in the U.S.? Researchers at the Medical College of South Carolina found that two factors are likely responsible for these increasing rates. Number one, more people in the U.S. are living with HIV or AIDS because of how HIV affects the immune system, and HIV infection can put someone at higher risk for developing cancer, including anal cancer. And number two, smoking, particularly in women over 50 years old, has been associated with an increase in anal cancer rates. How do you develop anal cancer? HPV is a common STI, or sexually transmitted infection, in the United States. In fact, the National Institute of Health estimates that more than 90% of sexually active men and 80% of sexually active women will be infected with HPV in their lifetime. It is normally asymptomatic and sometimes causes genital warts. But certain strains of HPV are high risk and can increase your chances for developing several types of cancer, including anal, cervical, oral, penile, and vaginal cancers. Two high-risk types of HPV are called HPV-16 and HPV-18. These types are responsible for most HPV-associated cancers. Usually these viruses can be cleared by the immune system, but there is a chance that they will not be cleared and may become persistent or can hide without symptoms. Over time, cells that are infected with HPV-16 or HPV-18 for long enough can develop cancer. What kind of cancer it is depends on where it develops. For example, anal cancer develops from cells in the anus. Who can get it? Anyone can get anal cancer, but certain factors increase your risk of developing it over your lifetime. One of these factors is infection with HPV. Most commonly, for anal cancer, this is infection with HPV type 16. Another risk factor is lowered immunity, which could be due to HIV infection, receiving an organ transplant, autoimmune disorders, or other causes of worsened immunity. Other risk factors include sexual activity. Having more partners leads to an increased risk of contracting HPV. Later in life, this may lead to the development of anal cancer. Having anal warts, having an anal fistula. An anal fistula is an opening between the anus and the outside skin, which is not part of the anal canal. Having another HPV-associated cancer, such as cervical or throat and mouth cancers. Smoking. Smoking may make the immune system less effective in fighting HPV. This may allow the infection to persist, which could lead to anal cancer. Demographic factors such as race, ethnicity, and sex. Certain demographic groups have higher rates of anal cancer. For example, anal cancer is more common in white women over the age of 59. This group accounts for the highest number of diagnoses of anal cancer in the U.S. In addition to this, a disproportionate number of African American men born in the 1980s or later have a higher risk of anal cancer. This is thought to be because of the prevalence of HIV in this population. Age. Anal cancer is most commonly diagnosed in people that are on average 55 to 64 years old. Who is most at risk? Here, we have 3 examples of groups that are at higher risk for developing anal cancer than the general population. First is transplant patients. When you receive an organ transplant, you will most likely be put on medication to suppress your immune system. This immunosuppression can increase your chances of developing cancer. Many types of organ transplants can increase your risk. A recent literature review found that solid organ transplant patients had a 13 times higher risk of anal cancer than the general population. Next, infection with high-risk strains of HPV such as HPV-16 and 18 is associated with anal cancer. In fact, HPV has been detected in 90% of anal cancers that are tested. Finally, people living with HIV and who are also part of the MSM community have a high risk of anal cancer that is approximately 55 times higher than the general population. This is why, if you are a part of these high-risk groups, it is important to get screened and to pay attention to signs and symptoms of this cancer. With all anal cancer stages combined, there is a 70% 5-year survival rate. The survival rate is higher when the cancer is caught at an earlier stage. For example, 5-year survival is 83% when it is found at a local stage, and 67% at regional stages. However, the 5-year survival rate decreases if the cancer spreads to distant parts of the body. For example, it is 36% at distal stages. If anal cancer is caught and treated early, this will result in better survival and recovery rates. Symptoms. If you are at a higher risk for developing anal cancer, there are certain signs and symptoms you may look out for on a daily basis. These include rectal bleeding, rectal itchiness, finding a lump or mass at the anal opening, having pain or a feeling of fullness in the anal area, narrowing of the stool or big changes in bowel movement, abnormal discharge from the anus, incontinence of the stool, and swollen lymph nodes around the anus or groin. If you have any signs or symptoms, it is always best to be seen by a doctor and get screened. Prevention. If you are under 45 years old, it is not too late to receive your HPV vaccine. The HPV vaccine protects you against long-term infections with HPV types 16 and 18. This not only prevents anal cancer from developing in the future, but could also prevent an array of cancers, including cervical, penile, vaginal, and throat and mouth cancers. Another way to prevent these cancers is to use physical barriers from STIs, for example, condoms. This will prevent the spread of HPV and thus lower your risk. If you are an individual living with HIV, getting treatment for HIV will help slow its progression and protect your immune system. This way, you are less likely to develop long-term HPV infections. This may decrease the risk of HPV-associated cancers, like anal cancer. Finally, stopping smoking can also prevent anal cancer. Smoking may burden your immune system, so if you quit, your immune system will be better equipped to prevent prolonged HPV infections. Screening. As mentioned earlier, if you are in a high-risk group or experiencing symptoms of anal cancer, it is important to get screened. There is no federally recommended screening schedule, but some medical practitioners suggest that those who are HIV positive get screened yearly, and those in other high-risk groups get screened every 2 to 3 years for anal cancer. These screening types include, but aren't limited to, a digital rectal exam, or DRE, an anal pap test. This test works similarly to the cervical pap smear, where they swab the affected area. This is the recommended screening for high-risk groups, such as HIV-positive people or those with a history of genital warts, and women above 45 that are HPV-16 positive. If the screening test comes back positive, other tests can be done to make a diagnosis. These tests may include one or more of the following: an anoscopy, endoscopy, biopsy, and imaging methods such as X-ray, CT, MRI, and PET scans. On the left side of the slide is a QR to find medical providers in your area that may provide screenings for anal cancer. Choose your area or city, and then search for anal and rectal cancer specialists. Support networks. If you or someone you know has cancer, support is important for their mental health and can even be helpful for their recovery process. You might find support through your friends and family. Those close to you may know you best and be able to help you through tough times. You may also choose to use online support networks or digital support groups to find understanding peers or even those in the same situation as you. Counseling and therapy that are specific to cancer support are also available online. Lastly, you may find local support organizations or nonprofits that can help provide you with resources, cancer education, or even finding friendships with those who understand. The Anal Cancer Foundation has a support page with useful resources for those with anal cancer. The link to this resource will be provided in the description below. Thank you for listening to this presentation. This presentation was provided to you by Cancer Pathways. At Cancer Pathways, we've designed our programs to empower people touched by cancer. We host events, educational workshops, groups, wellness classes, and workplace support, all at no cost to our community.